Hi, my name's Graham, and I'm a registered psychotherapist. I think the common concerns I see things like depression and anxiety, those are big ones. This world is a busy and oftentimes lonely place. But, I also, part of the reason why I like compassion focused therapy is that a lot of times I notice that whether it's cultural or individual or some mixture of both, more likely, we can be really hard on ourselves in a way that we would never be on someone else. Developing that compassion is very difficult. It's very trying, but very worthwhile and can really pay dividends. Meaningful strides can be made if you're feeling anxious and you're developing a chastisation of yourself or being mean towards yourself, then just being a little bit compassionate and understanding can go a long way of actually reducing the anxiety. And same thing with depression. My role as therapist when I'm working with clients is to be there for them in the way that they determine. The sessions are client led, meaning that you're in the driver's seat. What I'm there to do is support you in whatever way I can and whatever way you want me to, right? Like, if you want me to just sit there and listen, I am more than happy to do that. Whatever your issue might be, if you're suffering from anxiety, let's say, and you want something to help you overcome the anxiety, then that's something that we can work on together and see what works. But again, it's a dialogue. We are working together. I am not in the driver's seat. The client is. I'm trying to follow their lead as best as I can and do what works best for them. How do I know if this is the right therapist for me? The most important question you can probably ask yourself as a client. There's never going to be a perfect answer. There's no perfect match necessarily. Do you trust that person? Do you like them? Do you find that their style of therapy works well with you? Is their modality working well with you? Now, that can shift. People can shift that. So I don't want to harp too much on that. But when you think of your therapy sessions in terms of the person that you're working with, do you want to see them again? Do you enjoy working with them? That's really the crux of it. I find most rewarding the relationships I get to make with people, quite simply. I like people. I like people a lot, and I just enjoy learning about people and watching someone grow. I mean, who doesn't want to see another person grow and learn their capacity for self efficacy, for agency, for, to become more of themselves, whatever that means to them, become more of themselves? Why wouldn't that, or how couldn't that be rewarding, I should say?